process of scheduling a patient, how to create a patient's chart, and we discussed the patient forms and sending them to, of course, that would go to the patient portal and, completing those on the portal. Today, we're going to look at as if like this is the day of the patient visit. So the day that they're arriving, we'll collect the copay. We'll take a look at where the copays and charges are stored. We'll take a look at where the driver's license or ID and insurance card is in the system, and the consent forms. Who is going to share their screen?
I'll drive it.
Okay, that's perfect. Perfect. Let's go ahead and open the scheduler. Do you remember where that's at? Perfect. And again, that always does like just take a second there to pull up. Again, we have all of our columns here, and obviously we do not have an appointment scheduled, so we of course will practice scheduling an appointment again, but again, in theory, we'll act as though that appointment was already on the scheduler.
Okay.
And go ahead, you can pick any time on any of those columns. You will just select that appointment time. Perfect. And yep, a reminder, you can also do any new blocks or new holds as needed. This of course is staying in the past. That's completely fine, just because again, we are just doing a test appointment.
Okay.
And you can see at the very top, that's where you can search for the patient. Again, if you do not already have the patient pulled up in the background, there's the identical search for patient there in the background on the left-hand side. If you already have the patient pulled up in the background, then the patient's name will already be on this appointment. And I believe your test patient's name, Chris, was, let's see, last name is patient. So just typically we advise just if you try to search by their last name, it won't pull up. Yep. So let's click that test patient. Since you have selected your provider column and the facility is already there, so those are good to go. The appointment type, let's go ahead and we'll pick an appointment type. Again, you're going to either double click or single click and use the arrow. Again, in the top right, we have our instructions that if you were scheduling the appointment, again, we're pretending this was already scheduled, but as a refresher, your instructions, any comments, go ahead and add a comment just so we can also show you where that will be on the appointment once it is scheduled. Okay. And again, the referring provider, if it is a different referring provider, you can see where it has Heather Haley selected. Again, if Heather was not the referring for this appointment, you would just click the self-referral, which would be under you, Chris. So again, just depending. And we'll go ahead and click save. Perfect. Go ahead and click on the appointment. So you can click on either the far left column or the right. Yep, perfect. Either one. It has the exact same menu. You can see on the very far right, under where it says the test patient's name, you can see like their date of birth, their phone number. We haven't added insurance yet, but next to that umbrella, it's the third icon down. That's where their insurance will be listed. The $sign will show their copay. Again, we have not done that yet, but that's where you'll be able to see how much they owe for their copay. If the patient has a balance or their family, so if this was like a responsible party and they have other family members associated to them, they could, of course, show multiple family members' balances. for their total. And you can see kind of towards the bottom here where it says please fast for this appointment. So again, that is the appointment comment. So you're able to see that right there. The menu on the left. So you can see at the very top if you needed to edit the appointment. Again, we have not added their insurance yet, but their insurance eligibility will show a green circle with a checkbox in it next to the insurance eligibility if it was eligible. Again, our system processes eligibility 3 days prior to the appointment as long as the insurance has been listed in the patient's chart 3 days prior. If it's like a same day appointment or under 3 days, then the staff would just manually check the eligibility from the patient's chart. There is collect copay, which we'll do that in just a moment. The check-in, check-out, if they've canceled, no-showed. And you can select the patient. Again, that just pulls up their demographics, and like more of their demographics than what's on the right-hand side. Go ahead and click the patient forms for me. So a reminder, we of course did this last time. And again, this is what you'll have to establish with your front desk staff of, you know, who's going to be responsible to check for the forms, when they're supposed to be checking for those forms to see if they're completed, whether they check the morning of, the day before, right before they check in, to see, of course, if they're completed. You can see that last completed column. So again, that's the last time we completed those the HIPAA, the medication history. So of course, some of those consents are only going to be like yearly. So they would just be looking to see when the last time they completed them, if they need to send them out for the year. But if it's like a patient form that they need to fill out for the specific appointment, of course, they'll want to see if that's completed. Or again, if you're having them complete these during check-in, you can of course use an iPad or a tablet. You'll want to download the patient kiosk app. And that patient kiosk app will allow your patients to check in on the app. They can like take their photo if they have if it's an iPad, they can take their photo. They can complete their forms, collect their copay. And once they complete that, it will check them in. So depending on, you know, there might be cases where you may just want your patients to complete their check-in and complete their paperwork at the office. If you do the check-in with, and this is iPad specific, in the top right where it says generate PIN, there's a little button that says generate PIN. You can disable the generate PIN if you want to, it's your choice, but the generate PIN will be you can click on it. It's a 4-digit PIN that your staff will provide to the patient when they're checking in on the iPad, and that will help pull up their, like it's part of the verification to pull up the patient's chart for them to check in. Again, if you have the iPad, you want to have that PIN enabled, then you could use that. If you needed to send forms to the patient, again, remember that far right column says action, and it says add under each of those forms, because again, we sent these out last time. I believe last time we scheduled the new patient appointment, and that is the only one right now that I believe we have the forms attached. So again, you will just have to decide which forms you want attached to which appointments, or again, if you do not need them attached, this is where you would just train the staff on when they need to send which forms for which appointments or which follow-ups. Any questions again on how the forms work, when you would send them, how you would send them?
No, I don't think so.
No.
Okay, so we can go ahead and close this. And go ahead and go to collect copay. And I'll update that payment code to OF. So where it says PP, that just means patient payment. But I typically update this to O as in Oscar, F as in Frank. That just lets like the, you know, because of course we have a billing team that helps as well, and other people looking in the office key, they'll just know, oh, this payment was taken at the office. Again, we have not entered the copay yet. We'll be doing that on our next session. The copay due would populate just showing how much their copay is once it is added to the insurance chart card. But you can see below the copay due, it says payment amount, so you can type in any payment amount. For example, if they owed more than their copay, you could process all of that. And right now, if you do AMD Pay, it will be a slightly different screen. So of course, obviously we would do training on that if we go there, but this is what it would look like right now. And if you choose like Visa, credit card, like a card, the next screen, it will take you to it pulls the responsible parties information to verify like the billing information. And then the next screen, you would type in the patient's credit card. If you have OpenEdge, so that's again our other vendor, but AMD Pay is newer, so it's up to you. You could choose either of them or both of them. Again, the one advantage I would say for AMD Pay again is just having the option to run their telehealth copay on the telehealth visit. So again, just wanting to mention either or is still an option. Right now, we're just going to pick cash. This is a live key. We will void this payment afterwards, but of course, we're just going to push cash because we're going to post it. You can add a note at the bottom, and you can also print a receipt if the patient needs a receipt. Also, if they have access to the patient portal, they should be able to see this payment as well. And go ahead and click OK. This will ask you to begin a new batch. So a batch, what that is, it basically is per user. So each user that's working in the practice management and posting payments, they will open a new batch at the beginning of their shift, or as you can see, anytime they go to post their first payment of the day, then it will store each payment that user takes per shift, so you can keep track, so you can do your totals, balancing, your funds that are for each day. If there was ever a question, if the patient called and had a question on a payment, you could see who took that payment to ask that person. So that is what a batch is used for. The batches are closed at the end of each day by our team when they will close them, usually way late in the evening. But then again, the next day, your staff, whenever they would go post a payment, or I'll show you where they can open their own batch at the beginning of their shift. They could also close their batch at the end of each of their shifts if they chose to. In the right corner there where it says begin new batch, go ahead and click on that for me, Chris. Thank you. And then just click OK. And of course, as we go through some of our trainings, it's not going to have you open a batch every single time right now because we're not closing your batches every day because you're not currently live in the software. If you collect the copay, it automatically checks the patient in, as you can see. So it moves that visit from coming up to in office. Also, in the appointment in your column, you can see there is a blue dot on the left-hand side of the patient's name. So that is saying they're in office because that blue dot is next to in office on that far left column. So up all the way to the left. Yep, see how they're, yep. So that's just like an indicator that they're in the office looking at the column, but then of course also it moves the patient's appointment to in office here as well. And a reminder, we set up the rooming during our configuration. So right now it's defaulted to say the patient's in the waiting room and they're checking in. On the right hand side of checking in, it says 0 minutes. And again, that will start counting up. Once it is reached, I believe we set it at 10 minutes. I can always check if it's not, but it's, I believe, 10 minutes. If the patient's been in that status for more than 10 minutes, that box that the 0 minutes is in will turn red as a reminder to your staff that they've been in that status for more than 10 minutes. And then, of course, whenever they have checked in and are ready for the nurse, you could go ahead and click on that waiting room box and then click ready for MA and then close. And then the 0 minutes will start counting back up again. Anytime you update that status, it starts back at 0 and starts counting back up. Any questions on checking them in, rooming them, collecting the copay?
So
As I
looking at the schedule, this is like
oh, go ahead.
1 to 15 and then 15 to 30, right?
So that's actually a 30-minute appointment, I believe. Yeah. And so I think this one's from 1:45 to 1:15. Click the edit appointment. It's that little pencil icon. Or edit appointment, either or, yeah. Yeah, it is a 30-minute appointment, and the time, well, it says up at the top right, 1 p.m. So maybe it is the 1 p.m. column. And I think it just was confusing me the way it looked, but yeah, it is the one. So it's 1 to 1:30. Okay, yes.
Okay.
Yeah, perfect. Okay. Just a reminder, if you accidentally check the patient in and they were not yet checked in, the top left above where it says coming up, there is all these little icons, and it's the circle that's half empty, half full. We refer to that as the Pokemon ball. Go ahead and click on that. This does show, of course, if they've checked in or checked out, the times they've checked in, checked out. On the left-hand column, you can see if they've confirmed their appointment. I'll also be showing you another report to see if they've confirmed their appointment. So just in case you ever did accidentally check a patient in, what you would do is just uncheck that they're checked in from this report, and then it like checks them, like, so they weren't checked in.
Okay.
Yeah. So you can go ahead and close this. And what we're going to do next is click on that patient's appointment and click select patient. Again, that pulls the patient up here on the left-hand side. On the right-hand side of their date of birth, we're going to click on that pencil. And this is how you can open their chart from the scheduler. Or you can click on the insurance eligibility and it takes you to their insurance chart card, either way. So again, this is just the main, patient's demographic screen. Where I want to look at first is the history. So there on our far left menu, click on the history and it has the purple circle. Yep. This is just a little, sometimes again, there's like little like pop-ups that, tell you different things about the patient's chart. So you can, of course, just, yeah. So this history, this is where all the patient payments are stored and all the charges are stored when they come over from the EHR. And then also this is where you'll be able to see your insurance payments once they are posted to those charges. This screen always defaults to open items. So this box here in the middle, in the top right, you can see there's a circle and it says open items. Open means an open balance, whether that's a patient or insurance. So that means it's a balance owing or a payment. All items, obviously, you could click all items and then it's going to have the reload button will flash to reload. That will show everything. So if there's ever a time that you're like, I know the patient was seen on this date of service, but it's not showing here. If it's on open items, it could just mean that it's paid in full, so it's not being displayed under open items. So just remember you have to update to all. And voided items is meaning that you voided something, and then there's unbilled as well. So just a few things on that. Towards the left, there is more filters that you can use, like newest, first, oldest. There's up to 50 lines on this main page. So you can see where it says like 1 of 1 of 1 directly below your mouse. So there could be more than one page if there's more than 50 lines. So you can look at other pages. And again, you can like search by data services and provider, things like that, just depending on what you're looking for. To recognize an unapplied fund, and again, an unapplied fund is the copay. We always suggest to post the copay from the scheduler. And the way to recognize it as an unapplied fund is you can see on the very far left, there is a U. Yep, and that means it's an unapplied fund. Also in the paid applied column, it says -30. So again, that is indicating that it is a negative balance because it has not been applied to anything yet. So again, this is our payment that we just posted. And we're gonna go ahead and just void this because again, this is a live key, or I mean, we can leave it here for future trainings if we want. Let's just leave it here. We'll probably, you know, need it in another training anyways, so we can just leave that here. Typically, like around go live, I like go make sure that we've voided everything out of our test patients. Any questions on the history tab?
None so far.
Okay, perfect. Next, we're going to look at the chart files. Again, here on our far left, you can see at the bottom, it says chart files. Towards the top right of this box here in the middle, you can see where it says like Blue Cross Blue Shield, DL. So again, we uploaded these on the patient portal. So that Blue Cross Blue Shield is their Blue Cross Blue Shield insurance. The DL is their driver's license. And there's the medication history consent and the HIPAA privacy authorization consent forms. I believe we have these as auto accept. So once the patient signs those and sends them back, it automatically accepts it into the patient's chart, and this is where it's stored. If you do not have the auto accept on and you have to view it in that report menu we looked at earlier where you can see the patient forms, you would just click the review and accept it if it's a form that needs to be accepted. You'll also be able to see these consent forms in the EHR. Depending on what, you know, the consent is. We'll, you know, when we get into the EHR training, we'll talk about how the medication history consent, some of these consents are helpful. And for example, if the patient didn't upload these on the portal, say that they're coming into the office, they brought their cards with them, there is the scan. So towards the right hand side of this box here in the middle, these blue buttons. Yep. Once you're ready to set up the scanner for the office, you'll click that scan button. It'll ask you to download, and then you will just, you know, connect that printer or scanner with this, with the Advanced MD. And then they're able to scan in cards to the patient's chart. The import is if you have to import from your computer, and that's kind of like what we did on the portal. If you had like a copy, if for example, maybe they emailed you a copy of their card, then you saved on your desktop or something like that, you could import. Click that import for me. I just wanted to show you one thing that is helpful to know if you're uploading. So go ahead and just click on a document. We don't have to completely import it. We'll just take a look at what it looks like when you do need to import it. So of course, yep, you would click that document and click OK. I wonder if this is because, well, the name at the top, you can rename it. So you can, of course, if you want to again, it's just going by whatever. If it is their ID, you can see where it says other ID, and you would just move that over to the right-hand column. Again, that's if it's their ID, because that will help map it to show their ID in the patient's chart. It'll show a picture. And you can move unspecified over to the left. Perfect. If it's an insurance card, you change the file type to where it says miscellaneous, go to billing. and then you move the, oh, I wonder if this is because it's a different type of document. Because usually it says insurance card here. Click cancel for me. Let's just try something. Click import one more time and pick a pick a PDF for me if you don't mind. And again, we don't even have to take a look at it. I just want to see. Okay, there we go. It's similar to what we just did. Again, you would just update the file name and under miscellaneous, under the billing in the insurance card. So the insurance card, it's important to have your staff update that, both the ID and the insurance card. If they do it on the portal, it maps it in the system for you, so you don't have to do it. But if you're doing this manually, uploading it yourself, because this insurance card, when you list it as the insurance card here on this file type, it shows an image of the insurance card in the patient's chart, and then also the ID. For example, like you can see in the top left under that search for patient, all the way to the left, you can see that's the driver's license that we uploaded. So it just maps it so you can see the picture of the patient. But you can just click close. We'll just close this. But again, this is only if you're importing from your computer. If you're scanning, then you'll scan, but you'll still follow those same steps of updating it to ID and updating it to the insurance. Any questions on that?
No.
And if you click on like the consents, you would be able to like open those and look at them if you needed to. Yeah, right there.
From here or from here?
Either or, like typically you can just click on it right there. And sometimes you have to double click and it opens it for you.
Yeah, it pulled it into another window.
Oh, there, yeah, I was gonna say sometimes, yep, it does open it into the other screen. So again, if you needed to look at those consents, you'll see it a little bit differently when you're in the EHR, but from the PM, that's how you would look at it.
Okay.
Any questions on the chart files, what you would use the chart files for, how to upload, how to import?
No questions.
What we can look at next is here on the far left column, click that insurance chart card. Perfect. And in the bottom left where it says select one card listed, go ahead and use that drop down. And yep, there's that Blue Cross Blue Shield. That's why I always advise to like name it the insurance name. That way you know what insurance card it is. So here's an image of their card. We always, again, are going to suggest to scan the front and the back if you're scanning it in the office. That's because, again, the billing team, on the back of the card, a lot of the things that the billing team needs is on the back. But of course, if like somebody accidentally, miskeyed the ID number, the billing team would be able to see an image of that card and just they could quickly come in and update that. If there's no card on file and, the system pops up an error that, hey, the insurance ID is incorrect and you don't have a copy, we don't have a copy, then you're going to have to reach out to the patient and say, hey, can you send us a copy, upload it to the portal? Can you provide us that, image so that way you have the right information? And again, there could be multiple cards there listed. Could be older cards if it's inactive, but that's again why I just suggest to like name, the name of the insurance. You could even do the year if you want. Directly above where we just selected that card, you can see there's effective dates. It does go to January 1st. It's about the middle of that right there. So that's effective. It defaults to the January 1st. Again, you can change it if you need to. The carrier is directly below. So this is where you're going to add the insurance carrier. So you'll click the box with the 3 dots on the right-hand side. Yep. Use the % sign in the search criteria. The % sign is a wild card. So you can either type the % and part of the insurance's name, or just click that and it pulls up all of your insurance carriers. Just a reminder for Medicare, Medicaid and Blue Shield, they all start with your state. So as you can see, Alabama Blue Shield, Alabama Medicaid, Alabama Medicare. So you'll have to remind your staff that those 3 carriers all start with the state. And let's go ahead and we will select one of those insurances and then click OK. Directly below the carrier, you can see it says primary. This is because the system's saying, hey, this is the first insurance you're adding. We're assuming it's the primary. The group name and number, if you have that information on the card, you can enter it. It's not required, but you can if you'd like to. To the left, we have the subscriber. So it says test L patient. Again, this will default to whoever is the responsible party. So if it's a different responsible party than the patient, that's who is going to be listed here. If the subscriber is somebody besides the patient or the responsible party, you're going to delete that responsible party's name.
Let's see.
Yep, just right there in that box it says test patient.
Okay.
Perfect. The 3 dots, the box with the 3 dots, we always suggest to search to see if the subscriber is already in the system. So if that person is already listed, you can again use the % sign here. So go ahead and use the % sign and click search. Of course, we don't have a lot of patients in the system right now, so it's not going to pull up. I would obviously suggest if you're searching for a subscriber to use their last, after the % sign, to use their last name. So for example, you would check if this test patient had a family member with the last name of test, or excuse me, the last name of patient, then you could type in patient. It's going to pull up any patient that matches that name in the system. So again, we'll just suggest to just double check to see if that subscriber is already in the system, especially where you're, family practice, it could be very possible. To the left, if that subscriber is not in the system, you will click that subscriber button that's blue on the left-hand side. Click family member is subscriber, and then you're going to add the last name first and the first name. That adds the address already for you and their phone number, so that's kind of helpful. The only thing that you do have to have for the subscriber is their date of birth. Obviously their name, address, and their date of birth. If you do not have their date of birth, it will not let you save it. So if you don't know their subscriber's date of birth, or that family member is like, yeah, I don't remember the year that they're born, something like that, I would just leave the subscriber as the patient until you're able to get the subscriber's details. Okay. You can go ahead and just X out of here. Perfect. Directly below the subscriber is where you're going to add their ID number. So go ahead and we can just add like a fake ID number, or if you can see the ID number here on that Blue Shield card. And like you can see the XYZ, but I can't see the rest, but of course you can type whatever you want. Just a reminder for Blue Cross Blue Shield, almost all of their plans starts with alpha characters and sometimes numbers now too. So always make sure you add those or you will have rejections. The relationship is if obviously the subscriber is a different person, then you would change the relationship to however they're related to that how they're related to that subscriber. So if it's the child, if it's the mother, the father, whatever that may be. Directly below the relationship is the copay. So go ahead and you would type in their copay amount. Perfect. And their payer ID, just leave this blank. Our internal team sometimes uses that, but you don't need to do anything. The MSP code is only applicable if the patient has Medicare as a secondary to another plan. It doesn't say on the Medicare card. You won't know unless you have access to the Medicare website. My go-to is I usually always default to the patient's employed. So when you use that drop down, it says employed, because Most of the time, if the patient has Medicare as secondary, it's typically because they're of an age to have Medicare, but they currently have a job that they have insurance through, so their Medicare is secondary to that plan. Again, I just default that. Don't quote me on that's always correct. I just have found in my experience that's like one of the number one reasons. If you have access to the Medicare website and can check what their MSP is, then you can update it. You can add a note at the very bottom if you need to, and in the bottom right box there, and then go ahead and click save in the top right of this box. Once you save that carrier, you can see now that yellow bar has appeared towards the top. That code where it says ALA05, that's the carrier code. You'll just see a lot of the time throughout our system we have codes. You can always hover above it if you aren't sure what it is. Obviously, you can see the carrier name down below, but if throughout the system, if you hover above that, on that yellow bar, it's the second to the left. Yeah, if you hover above it, it will show you the full name. Yeah. Above the sequence SEQ column in the code, it says insurance order. It has a number 1, and you can see under that sequence column, it's number 1. This number will always be tied to this insurance, no matter if it's active or not. And this goes on the order that you add the carrier to our system. So if you go in and add another carrier, it will be sequence number 2. Say that number 1 is no longer in effect and number 2 is now the effective. So you would then change that insurance order to number 2 and then save the order. That insurance order is going to be very important to tell our system of what order to bill the insurance if there's more than one carrier. And also, again, if this plan now is inactive, you add another plan. Number 1 is no longer active. It's now number 2 that you'll be billing. Does that make sense? Okay. To the right, you can see where you can click that check eligibility. It's not going to work right now because, of course, Change Healthcare is still down, but when you can click it, it's not going to do really much, but you can still click it. You can see that it will say the last time it was checked directly below. Again, that eligible column, it has the little clock in it right now, but it should, again, if they're eligible, have a green circle with a checkbox. If it's ineligible or has an eligibility issue, it will be a yellow triangle. And in that eligibility comments, it will say, oh, the subscriber ID is wrong or they're no longer active. You can also click the details, which is directly above the eligibility comments, and that details will also give you more information. If they are active, it will show you their copay amount. If the patient's unsure about what their copay is, it'll show their coinsurance and it will show their deductible. And most of the time it will show how much of their deductible they have met so far. So again, that's just a benefit to having our system, is that we'll check that eligibility for you and show you those details. Of course, right now, it's not so helpful because we're still in the midst of this, Change Healthcare outage. If you need to add a new carrier, if there's now a carrier here, you would just go to the right and click Add New below Save. And then you follow those same steps. And you can see now it's saying secondary because it's saying, okay, this other plan is still active, and now you're adding another carrier. Click on that carrier box for me, the 3 dots again. Say that you can't find the carrier. Say you searched in here and that carrier is not in the system. In the bottom right, you'll click import and you will search. You can search by the carrier name or the CPID. The CPID is our payer ID that Change Healthcare uses. And I'll show you where a link to their website is here in just a second. Of course, it's not working, but there is a link. But you can search by those 2 areas to search, and that will import if you're able to find it, it will import that insurance for you. If you cannot find it through the import search, just reach out to whoever you're working with at that time, whether that's me, your revenue cycle specialist who you work with right after implementation, or your final billing team, and they'll help you get that carrier added. Okay. You can just click close here. And then you can just close here as well. And that change healthcare link is right above the Blue Cross image, the card. It says change healthcare. Yep, right there. So you could click on that and you can search by the payer's name, by the insurance carrier's name, or you can type their payer ID on the back of the card, and then it will show you change healthcare CPID, which again is a 4-digit number. Okay. Any questions on the insurance chart card? What we can look at next is go to the responsible party. All the way on the far left or the far right, either of them you can choose. Just a reminder, like, so the left is kind of just like the chart card, like, you know, name, but some of those chart cards on the left, they're just expanded so you can see more information, but you can still access that card by clicking on the responsible party name on that chart card. This again is if the patient has a responsible party. That case, it's typically if the patient's under 18. Any patient that's over 18 is their own responsible party, or if there's maybe like a power of attorney and this patient, patient is no longer able to care for themselves and they have a directive from this, from the court saying that this person is taking care of them. Or there may be the case where it's an elderly person and maybe you would leave this as the patient's name, but maybe the Mel is going to the daughter so she could take care of the bills, something like that. So you could update this to a different address because whoever is in this responsible party is going to get the bill. If you need to update this, you can click clear in the top right.
Do I click it?
Yep, go ahead. And click continue. Good old mouses. You would then search for the responsible party, just like we did for the subscriber. You'll click the box with the 3 dots to search to see if that responsible party exists in the system. Again, there could be that chance. If, again, this is a parent and they have multiple kids, then you would search for them. If it's not in the system, you would close. So say we did not find that responsible party, so go ahead and close here. Same as everywhere else in the system, it would be last name, comma, first name. So you can go ahead and we'll just add a different responsible party. You could do like patient and then do a different first name. Perfect. And then the same address or a different address, depending. You can see the patient's address there and the patient chart card on the far right. So if you just need to like see what the patient's address is, if it's the same, you can just type that in. And then the zip code, remember the city and state populate from the zip and just hit tab. Okay. Update the sex, which is in the top right. Same with the patient, the 4 same things are required: the name, address, sex, and date of birth. So go ahead and add the date of birth, which is 2 options down. Perfect. Okay. You can add a different preferred phone number, of course, if it's a different phone number, and you can add a different email if it's different than the email in the patient's chart. And go ahead and click save. You also have the email here, and even if the email is in the patient's demographic, you can also send an invite to the portal from the responsible party. So next to the responsible party's name, click that little box. It looks again like that little blue person looking at a screen. On the right hand side of the new patient.
Let's see. Is it?
Back here, the box in the left next to the account number.
There we go.
Yep, right there. Yep. So again, you can also, again, you've already logged in everything, but this is also just another way you can send an invite from the portal to the portal if you need to. So you can click close. Okay. Any questions about the responsible party? We'll get into a little bit more detail about this card in another session, but this again is if you need to update it if the patient is not their own responsible party.
No questions for me.
Go ahead and click on the care team chart card. Again, either on the far left or far right. Perfect. Yep. Again, this is if there's other, providers in-house that this patient is being seen by or part of their care team. It could be their referring provider, or if you're referring them out to a different provider and you want to list them as a care team, or a facility. In the top right, it says add member. You click that green plus sign. And on the left, you can see internal, and under the team member with the red asterisk yep. So this would be your own. So again, this would be any of your providers. Then you would just click save. Yep. Then there's external, which again would be like somebody outside of your facility. And then the facility would be if, you refer, like if they were having surgery or something and, part of that care. But again, any of those would have to be listed as a referring provider if it's an external provider. And then the facility would have to be listed in your facilities to be able to add them. Okay. Any questions on what you would use the care team chart card for?
No.
Okay. Go ahead and click on the memos chart card, which is there. You can see it's on the far left. It says memos. Yep. And sometimes it says this. Go ahead and just click save. I don't think we actually changed anything, but it's saying that something changed. Okay. So this is a memo. This is used to display a pop-up memo when you open the patient's chart or anytime they're getting scheduled on the scheduler. You can also see this pop-up memo in the EHR. So down at the bottom box, you can see on the left-hand side where it says display. Here in the box, yeah. And then on the right, it says text. So whatever you want to have display, this could just be anything random. Go ahead and just type whatever you may think that maybe somebody might, want to see if they're opening this patient's chart. Patient is difficult. Like that might be a hidden one though. We'll talk about the hidden in just a second. You can add an expiration date, so then of course after that it will expire after that date. Okay. And then click save in the top right corner. Now here again under the memo on the far left under display, it says hidden. Go ahead and click hidden for me and type a message. This one is more like discreet. Maybe you do not want this to be displayed anytime that memo appears. If it's a hidden message, they actually have to come here to the chart card or the chart card in the EHR to actually see that hidden message. So it's not just going to pop up. There'll be an asterisk, and I'll show you in a minute what that asterisk looks like in the pop-up. And click save. There's a message option to add a message to their statement. This is one way you can add a message. It would be to their next statement, or again, if you add an expiration. Not sure how often you may need to add a message. I'll show you other ways you can add messages to statements during training as well. Okay. Any question on the memos, what we would use this for?
No.
Okay. Oh, there is one thing I did want to show you back in the patient's chart when you update the responsible party. Sorry, I forgot about that. So if you scroll up and we'll look at the patient's chart. If that menu, I don't know. Scroll up, right? Yeah, go back down and scroll. There we go.
Okay.
If you update the responsible party, you can see right where your mouse is, right above. So that will update, yep. And then down below where it says relationship, it's about halfway down your screen on the right-hand side, and it says G8 other. Whatever reason it always defaults to this one, you just update it to child. Most likely it will be child because, again, majority of the time it's going to be because this is a child and the relationship is the child to that responsible party. And now click save. So up above. Yep, perfect. Okay, sorry, I just forgot to mention that. Another is user, no, another, you are the user that changed it. Click OK. Okay, sorry, I got a little off track, but I forgot to mention that. Just wanted to say that. Okay. And on the far left menu, go ahead and click on notes for me. This is where our patient service center will make their correspondence. If your patients call our patient service center, this is where you can see a note that our patient service center will add. You can also use this for internal notes, anything that you want to document, maybe a call, maybe something that's going on with the patient, anything really. You would just click that new box or new button up in the top right and add a message. So click new. You can add a note type if you prefer. So you can click the box with the 3 dots and see we already have some in there. It's default. You can add others if you need to. So again, yeah, it could be anything. And then you could add a provider if you want to, if it's like related to a specific provider. And then, yep, so you can add your name. And then go ahead and type in just anything random. Of course, this doesn't, it's just a test. Okay, and then click OK in the bottom. Yep. So again, this is just a message in the notes. The only way you see this note is if you come here to this note chart card. Okay. Go ahead and close this patient's chart now. I just want to show you, we have to close it and open it to see the pop-up memo that we added just a moment ago. So on the scheduler again, just go ahead and click on that pencil icon. And let's open the patient's chart. Oh, that's the appointment. Sorry, the one that's, oh, well, this works anyways. See? Oh, it's okay. It works.
Yes, well, I saw it though.
Go ahead and click the X. And then click that pencil here on the,
over here.
Yeah. Hopefully it pulls